Welcome, everyone, to this session here in lovely Perugia. Has a dramatic title, Mis and Disinformation About Health is Killing Us. Very dramatic, but we know it's true. We especially know that from the pandemic, but it's still true way beyond the pandemic, and hopefully we're going to get into some of that today when we talk about the kinds of work these excellent journalists are doing, where they're addressing vital needs for information in their communities and countries, and examining corporate power and regulation that's supposed to be protecting the public globally. So let's get started. I'm Susan Ferriss. I'm a senior editor at the Pulitzer Center in the United States. We're based in the US, but we're a global organization, and we provide funding and advice and guidance to journalists around the world. We're very interested in global health, and so we welcome applications from people if you're interested. You should check out our website, and you can see some of the projects that we funded. I want to introduce our speakers and let them speak for a while, and then we can have a conversation here, and we'll get around to questions eventually. First, I want to introduce Mia Malan. She's the editor-in-chief of the Bhekisisa Centre for Health Journalism in South Africa, a very excellent organization that just celebrated its 10th anniversary, correct? And filling a vital need for information in South Africa about health. Mia and her organization worked with me on a training, virtual training for journalists throughout all of Africa last year. Chrissie Giles is next to her. She's the deputy editor of the Bureau of Investigative Journalism in the UK, works globally. Chrissie has a long history in health journalism, which is really serving her organization well. And next to me is Will Fitzgibbon. He's a reporter and global partnership coordinator with The Examination, which is a new organization based in the US, but also works globally. Has worked with Pulitzer Center. And Will is especially interested in health scams and how corporate power is taking advantage of a vacuum in information and distrust. So let's get started. Mia, why don't you start off and tell us about projects that you think are really relevant for us to hear about?
Thank you, Susan. As Susan mentioned, I'm based in South Africa, so I'm going to talk about African stuff. And I would like to raise two things very shortly. It's about tobacco companies and the misinformation campaigns they have, and then the way in which pharmaceutical companies are very secretive about how much the development of a drug really costs and what the impact of that is in a country like South Africa. So I think one of the fastest moving dis and misinformation campaigns in the health sector at the moment are campaigns which claim that we've got all the information we need to know that vapes or e-cigarettes are safe, and that it's been proven that they are an excellent harm reduction tool that help people to not use traditional tobacco cigarettes. And in most of these campaigns, big tobacco companies are behind them, and they sponsor biased research to use in such campaigns. And the reason tobacco companies are into spreading misinformation about vapes is because they make the vapes, and because there are such clear links between the harms of traditional tobacco cigarettes like lung cancer and heart disease and your risk to have a stroke, because that has been established so very clearly. Many tobacco companies now have formal business plans where they plan to move towards the production of vapes only eventually. Now, in South Africa, we have a bill at the moment which will regulate vapes and traditional cigarettes in exactly the same way. At the moment, we've got no regulations for vapes, so you can sell it wherever you want to. But if that bill becomes law, there will be rules like no vaping in public spaces, you're not allowed to advertise, you're only allowed to sell it to people of 16 and older, and you would have to have standardized packaging, so all the vape packaging would have to look the same as with cigarettes. That is what will happen if it does become law. So you could imagine the upheaval in my country from tobacco companies about this bill potentially becoming law and their eagerness to spread half-truths. Now, as I mentioned, one of the biggest ways in which they do it is that they sponsor research, and their involvement in that research is not revealed, and then they come up with studies that have results that are biased or definitely not entirely true. Many of you may have heard of one study that the UK actually uses for policy making, that vapes are 95% safer than traditional cigarettes. It's a very doubtful study, not credible, researchers with links to tobacco companies, and you could see the harmful effect already. One country at least used it, although there are many changes around that at the moment happening. The obvious way to debunk this is to compare the results of the study to other studies and to investigate the authors. They are supposed to declare their conflicting interests, but they don't always do that. The problem with these two things, comparing it to other studies and investigating the authors, is that if you work in a general, fast-working, moving newsroom, it takes specialized skills and it takes quite a bit of time, and you may not always have that. So we, as a specialist health organization, do that for mainstream newsrooms. We distribute our copy to 6 mainstream newsrooms in South Africa, and we would do stories like, for instance, can nicotine pouches really be used as nicotine replacement therapy, as some studies claim? Or we would, for instance, look at the credibility of the 95% study which I mentioned. We've had some impact. One of our stories, as a direct result of us exposing the authors or the connections of a funder to our largest our top university in South Africa, the University of Cape Town, that they took money, a research unit, from an organization which had links to tobacco companies, which they didn't know had the links themselves. As a result of that, they had to return the funding and get clean funding from elsewhere. So that was as a direct result of our reporting. And other stuff that we try to do is to have podcasts with large research organizations such as, say, Cochrane Review, where they explain how to evaluate a study. Something we haven't been able to get around is we have these stories that debunk everything, and our partners publish them quite prominently, and then the advertising departments take advertorials, sponsored pieces basically, from tobacco companies which say exactly the opposite thing, and but often both appear on the same homepage. So that's something we're still trying to figure out how to get around. My second part is about pharmaceutical companies and how they are secret about how much a drug really costs. So in South Africa, all of you will remember during COVID how governments, your own governments, had to sign contracts for COVID vaccines that were completely secretive, and prices at which the vaccines were sold were not revealed. So in South Africa, activists, we've got a very active civil society with lots of lawyers. They had a court case of which the results, which was ruled in their favor at the beginning of the year, which forced companies such as Johnson & Johnson and Pfizer to reveal the prices that they charged the South African government. And from this, it became clear that South Africa, which is a middle-income company, paid more than the European Union per unit of vaccine when it came to Johnson & Johnson and Pfizer. And we also paid 25% more than the non-profit price, just because that secrecy was allowed. Now, when it comes to the disease that kills the most people in my country, which is tuberculosis, it's a completely curable disease, but it kills more people than HIV in South Africa. When it comes to this disease, there are quite serious implications as to who gets to live and who gets to die. So there is a drug called bedaquiline, which is very good to treat multi-drug resistant TB. So a sort of TB for which the ordinary drugs just don't work. And when you get that type of TB, the drugs that are available other than bedaquiline are horrible drugs. It's drugs that you have to take for 1.5 to 2 years. It's a very painful injection, and one of the most common side effects is that it makes you deaf. So you get to choose between whether you are cured from TB or whether you can't hear. Bedaquiline removes all these side effects, not all side effects, but the deaf one, and you only have to take it for 6 months. But until the end of last year, the last quarter of last year, Johnson & Johnson, again, the company making that drug, sold it at double the price to the South African government than what it sells it to other African countries who don't have an open tender system and gets it through a mechanism that we can't access. Now, you could imagine how many people in South Africa really need this drug, and if we pay double the price, our government can help half the people that it's supposed to be able to help. And the reason I'm talking about this is because we did something that we wouldn't normally do. We directly worked with activists, and I don't know if that's the way to go, but it had immense effects. So we reported on it, and as we reported, one of the main organizations fighting for the right price was Doctors Without Borders, or MSF, as some of you may know them. And they asked us, they put a webinar, a panel together, and asked us, Bhekisisa, to moderate it. Because we gave it a flavor of independent media, and the activists knew what they were going to say. We've never done something like that in the past, where we will collaborate with them directly and lead a conversation where the activists have their say. After this, following this panel, Johnson & Johnson, within 2 weeks, dropped their ideas to extend their patents in South Africa. They dropped their price to the right price, half their price for South Africa. And it would never have happened if the reporting and the activism didn't come together. But we don't normally see ourselves as an activist organization. We see ourselves as a journalism organization. So I'm mentioning it because I don't have a clear answer. Is that the right thing to do? To cross that line? If I didn't, those effects we would never have seen, but it might be crossing a line that a journalism organization shouldn't always cross. Thank you.
Thank you, Mia. That really raises really interesting questions about what should journalists be doing and what's at stake, and also reminding everyone of the opportunities are out there to report on global inequities and access to basic drugs people should be getting. Thank you. Chrissie.
Hey everyone, thanks for coming. It's really nice to see so many people here. When I was thinking about this session, I just wrote that good health journalism can save lives, which sounds like a massive pile of cheese. And also, if that came onto any of our desks, we'd probably put a little comment that said, fact check needed. So is it hyperbolic? I don't think so. And is it true? Yes. So to add to Mia's points, the Bureau of Investigative Journalism, as well as having possibly the least sayable name in journalism, is an independent newsroom. So we work from the UK, but we work globally in partnership with lots of different places. And our work is impact-centered. So what that means simply is, we're not just doing stories so our mums can read them and say, well done, you did a journalism. And then we can all be like, although that's still great, never gets old. But what we want to do is tell stories that have the potential to change the world for the better. And to Mia's point, lots of journalists can get a bit twitchy about that because they think that we're doing journalism to prove a point, or they think that we're working with activists and campaigners to push a particular position, and we're not. The way I see it is if we have two stories that are being pitched to us, and one is like a really good story, but all of the systems that make that inequity exist, so the governments, the businesses, historical abuses, whatever, if they cannot be changed, or there's very little chance of making something different or better. And another story has just as many merits, but also there's part of a system where we see a lever, where we can use journalism as a tool. So, to give you an example, during COVID, I started my job 4 days before COVID. I'm not saying it was our fault, but I did sit at my desk saying, oh my God, I'm the global health editor. I don't know what we're going to look at. Like, the globe is big and health is massive. And then we got locked down for 18 months. And I was like, oh, okay, right. Well, at least we don't have to decide how to narrow down our subject area. But basically, we look at global health at TBIJ in two ways. We look at the things that give people access to things that should improve their health. So, are you getting vaccinations, medicine, contraception, abortion, education? And then we look at the things that should be protecting people from harm. So these kind of harmful consumption industries. So the fun stuff, tobacco, alcohol, sugar. I'm joking, they're not fun, don't do them. So yeah, what is stopping you getting the stuff that helps you be healthy? And what is exposing you to stuff that can do you harm? And as investigative journalists especially, because that's all we do, investigations, which is just journalism where you just don't stop. You're basically a pain in the butt to your editors and to everyone around you, but it's great. So evidence is our business, and I studied biochemistry at uni, and evidence was our business there as well. And if you work on investigations, you work on a hypothesis-led model, which is exactly the same as empirical science. So basically, we approach an investigation with a hypothesis. We're not setting out to prove it, we're setting out to get evidence and weigh up whether it is true or not. So to give one example, during COVID, we heard lots of, and we saw this on the news, people were really struggling to access oxygen. And you know, we had probably friends and relatives who would be in an ICU or whatever, and you'd be like, oh my God, plug in the mask, get them on the... In lots of places, particularly lower and middle income countries, you don't have that piped oxygen coming from the big tank of liquid oxygen in the hospital. You have a cylinder that gets wheeled in, or you have a little machine that poops away next door trying to make you some gas. People were dying, they were suffocating because they could not get oxygen. And we heard loads of horrible accounts. There were loads of charities and patient groups just, you know, posting on Twitter like, has anyone got a cylinder? I'm in this part of India. Or has anyone got a cylinder? My uncle's dying. And it's just awful. And basically, no one knew how much big companies were charging in Africa. We went out and we asked. We got in touch with clinics in different hospitals, different clinics, different countries. And the pricing was totally different. In the same country, 2 clinics, in different countries. And basically, the 2 main companies, which, big surprise, are multinationals based in the global north, were just basically, allegedly, overcharging for oxygen. They were limiting hospital supplies, so they would give you a certain number of cylinders and then wait till you'd use them to give you other ones. They'd also fix you into their special type of fixer, so you couldn't then make your own oxygen because the plug was a different shape. And basically, we asked the question, which lots of people were asking, but we found the answers. We found the prices, we published the prices. That directly put into people's hands information so they could say, this guy's only paying this much for 40 litres, what's going on? But the other thing is, as we started to tell stories in some parts of Africa, we heard from other people in different countries, including in Mexico, where companies were sending letters to hospitals when they'd built their own oxygen plant saying, oh, that's bad oxygen, that will kill people. It's not true. They're like, 93% oxygen, you want 99% oxygen. Not true. WHO says, not true. Not true. They were sending letters. They were sending lawyers to hospitals in the middle of COVID to talk to doctors and be like, please don't use that oxygen you've just created. Absolute bobbins. So essentially, we talked to a big access to oxygen network who were doing loads of work during COVID. They normally look at pneumonia, which is a massive killer of under 5s. During COVID, they're obviously like, here's another big killer of loads of people. We worked with them really closely, and they basically said that our reporting into this oxygen scandal led to essentially $4 billion of global money being mobilized. But the biggest thing for us was that it brought the 2 big gas companies, the big multinationals, to the table to talk to charities, doctors, NGOs, organizations, governments. And they'd never done that before. And this sounds like a big boast, and I guess it kind of is, because if we hadn't have done that, more people would have died. Again, it's not rocket science to try and find the price of an oxygen cylinder. You have to do it, and then you publish it. But if you're not doing it, no one else is. And that, again, is why investigative reporting is so important. So please support your local investigative unit. And essentially, the other thing that happened was the WHO in May 23, so it took a long time, but they added medical oxygen to their essentials medicine list. I mean, it's not an essential medicine. It obviously was, but they have a capital E essential medicines list, which is the stuff that all countries should have and make available to all of their citizens, and it was added on there. So just to wrap up, because I could go on about this literally all afternoon, there's two main things we look at in investigations that we ask ourselves. So first of all, if the question you're trying to ask needs data to answer it, and the data doesn't exist, can we get it? So we did a project in the UK, no one knew how many homeless people were dying. On the way to work at our old offices, people used to kind of walk past rough sleepers, and one day they noticed that one of them was no longer there. And when they asked the council how many people homeless die every year, they're like, we don't record whether someone's homeless or not when they die. So we did. With this, we heard that, like in Peru, children start smoking at 13. Peru is signed up to a big agreement that most countries in the world are, where they don't advertise tobacco apart from in certain controlled conditions. But we thought they probably were advertising tobacco in these ways. And so it means like putting cigarettes nestled amongst sweets, or putting them at a child's eye level, or kind of like, you know, it's really, really sinister stuff. So we basically asked people in Lima to go into a shop, pretend they were doing a video chat with their, you know, best mate, and actually take pictures of the cigarettes. We checked it all, we did a map, and again, the Peruvian government used that to try and change the law. I don't think the law got changed, so brackets, impact. We looked at how much nicotine's in a big heated tobacco product. So again, you might just be a smoker who's trying to cut down on traditional cigarettes. You buy these heated tobacco, and you think, oh, I'm being much more careful. I'm really cutting down on my nicotine. We found out they had 8 times more nicotine in than the company was saying. Again, we tried to find a lab. You cannot find a lab that is not linked to the industry, apart from a lovely lab in Switzerland, which was great. But again, it's about putting the work in. So if the data's not there, can you work with people to generate it? And can that data be robust, non-biased, and basically non-industry tainted? And second of all, we believe that journalism needs to go beyond just revealing information. So it should make this new information that you get available to anyone that can use it to change the world for the better. And again, that sounds like, you know, change the world. But if you're finding something out and you're not putting it in the hands of policymakers or patient groups or officials or EU MEPs or wherever you are in the world, why are you doing it? And also, you need to make that information accessible to the people it's about. So we did a piece about farm workers in North Carolina who travel from Mexico. We did a comic book in Spanish because we spoke to them, we spoke to unions. They're like, this guy is not going to read your 5,000-word long read. Dommage. But why are you doing it if you're not making that information available? So we have a clear line. We're not campaigners. We're not going to be outside holding placards. But we're probably going to make that information in an accessible form for the placard makers so they can then go and do what they want with it, which is hopefully making the world better. I will shut up now, but I'm super excited to hear what Will has to say.
Thank you, Chrissie. Those are very great observations and reminders to people, and you know, trying to make things accessible while you're also doing your long, you know, well-written story that lays out all the evidence. Trying to find ways to make things accessible is important. We had an organization in Venezuela that does health reporting that we supported, and they ended up, during the pandemic, putting placards up in public places and on buses to bring their information to people. So they went the extra step in trying to distribute. And also your reminders about the profit motive. It never seems to end, does it? And there's ever creative ways that companies can look for and design to reach markets, and Will knows a lot about that. So take it away, Will.
Thanks, Susan. Great to be here. Yeah, let me start with is that on? Yep. You know, let's acknowledge some depressing statistics, which is that on average, 1 in 3 of you in this room is going to be... Oh, there we go. So let's start with a depressing statistic, which is on average, 1 in 3 of you in this room will be killed by one of 4 kinds of corporations or corporate activities: tobacco, alcohol, processed foods, unhealthy foods, and the fossil fuel industry. They're broad industries, obviously, but we at the examination have focused on those corporate actors Really, in many ways, because we think they're vastly undercovered in the journalistic landscape. I mean, time and time and again, we hear from reporters that they don't have, as Chrissie and Mia were talking about, those skills that these two newsrooms, and now we hope our newsroom have, right? That these powerful corporations are literally responsible for many deaths of us and the people we love, and yet there's far too little reporting on it. And there are reasons for that. I mean, there's a newspaper recently, a big newspaper, that published something about skiing in Italy. And the headline was something about how Italian skiers are polluting the mountains with these forever chemicals that are on skis. And it relied on this academic study that made the same statement, right? That skiers are polluting the mountains in Italy and causing potential harmful pollutants to exist in the atmosphere. And I remember reading that headline, and I won't use the exact English words I used at the time, but I thought to myself, God damn it, because the point is not, in my mind, that skiers are polluting the environment, right? Why was the focus not instead in that study and indeed in the journalist write-up of that, the companies making the skis that are using chemicals that are then entering our environment and harming us, right? So I think there's a tendency in journalism and in academia, as Mia was talking about and as Chrissie was talking about in these studies, to be tentative, to not have courage when it comes to the roles that corporations play in making us sick and in killing us. And that comes from an old playbook, right? Corporations are powerful. They have very well-paid lawyers. They have scary lawyers. And I speak to lots of journalists who say, well, the examination's mission is a great one, but I'm scared. I can say that a factory is polluting the air, but that's a big step to take an additional step in evidence and saying not only is the air polluted, but people are becoming sick because of it. So the examination in some ways exists to try and fill that gap. We're a collaborative, investigative, cross-border news outlet that works with journalists around the world and tries to provide them with scientists and scientific evidence that can cross that gap. So working with journalists in Cameroon or the Republic of Congo to test soil for lead, for example. Working with journalists in Latin America, for example, on vaping or the cigarette industry and taking samples of products and getting them tested. Things that journalists can't necessarily do in many newsrooms, because most newsrooms, even in the English-speaking world, even in the United States where I'm based, health journalists are, let's be honest, not often seen as the sexiest kind of journalists, right? Lots of you here have probably gone to panels about tracking Russian oligarchs and election disinformation and tracking corruption. Incredibly important topics, and I've done that for 10 years myself. I worked for the International Consortium of Investigative Journalists. I'm a total nerd, so I became a certified anti-money laundering specialist, so I love that stuff. That's my jam. But I was thinking about this. We've had, in the past 10 years, I'd say investigative journalism has gone through this complete revolution where reporters from Washington, D.C. to London to Jakarta to Ouagadougou in Burkina Faso to Ankara in Turkey, they've become specialists in identifying financial crime. Right? I think journalism generally has become better at identifying, ooh, there's a dodgy contract signed by, the best friend of Vladimir Putin, or, ooh, look at that mining deal that was signed by the wife of a minister. We've become quite good at financial crime and identifying red flags. I wonder if the next revolution in investigative reporting, the steps that need to be taken, are to train those journalists or a new generation of journalists in treating health investigations and corporate drivers of what makes us sick and what kills us in the same way. Equipping journalists so that when they see a study, they can do exactly what Mia has had years of experience doing, or that Chrissie's experienced in doing, which is immediately having this sense of, all right, before I publish it, before I talk about it, who funded this study? Why does this study say that vaping is 95% safer than traditional smoking? And a lot of that is a resource issue, right? As Mia said, this isn't something that we can all jump into overnight, but I'm excited to see that change and that development in investigative reporting. I think we'll soon get to the point where we no longer say, that industry is playing by the tobacco playbook. We hear that a lot, right? That big food or whatever is like following the tobacco playbook. They're all bloody doing it, right? They're all using that same playbook, because guess what? At the end of the day, a corporation is a corporation and they usually want to make money. one of the studies or the investigations we did recently, for example, was looking at social media and the way in which registered dietitians were being paid by or sponsored by big food companies, General Mills in the United States, for example, that makes Cocoa Puffs and things. And there's been this rise over the past 3 years, an increase 3 times in academic study references to something called anti-diet. Basically, it's this concept of you can eat whatever you want. You can eat ice cream for breakfast. You can eat all the Kit Kats in the world. You can go to a Choco Hotel and eat all the chocolate you want. And that's healthy. That somehow, that this anti-diet message is, we've all been told what we shouldn't eat, but in fact, we shouldn't be shamed by what we want to eat. So there's been this rise in academic studies talking about this, and guess what? Companies that make food like ice cream and sugary cereals love that. Not only do they love it, they promote it. So we did an investigation where we studied thousands of TikTok posts from registered dietitians, just in the US for this one, to show how they were pushing that message and also not always declaring who they were sponsored by at the same time. And that led to a whole bunch of interest in the United States from consumers, obviously, but also from regulators trying to crack down on these social media influencers who really aren't telling us who's paying them to say what. I might stop there so we can open to some questions. Thanks.
Thanks, Will. It's a great piece on the hashtags Stop Fat Shaming movement among the dietitians who are bought and paid for. That's depressing stuff, but there's a lot of it out there, and journalists love to find depressing stuff and deconstruct it. Speaking of which, deconstructing these stories, I'm wondering if each of you could say something about the challenges of doing that. We do have, for example, regulation. Inevitably, when you're reporting on what you're witnessing, what you're finding, you ask yourself, isn't somebody supposed to be watching this? So maybe you can touch on that to start with. Anybody want to go first?
Yeah, I can.
Okay.
Yeah, so I think, again, to talk about, to point the finger at companies when they're doing bad stuff is standard, and it's what they expect. And like Will said, you get some hilarious emails from lawyers, kind of, they do this like gaslighting, accusing you of being the ones that are trying to make children smoke more because you're investigating it and therefore making them look at these posters. And we're like, you put the posters there. I think where it becomes a bit more complicated is the bad guy in our stories sometimes it is lack of regulation, which as an editor, that is not a sexy villain. Oh, what? So, yeah, why? Who's doing this? Why? Oh, and there's just like a loophole in a national regulation, and you're like, ooh. But we did one story about, it's kind of an unbelievable story. One of our reporters spoke to an oncologist. Again, it's a really doomy, depressing story because our beat is doom, right? That's our thing. But basically, he had found out in Brazil, they cut the price of a particular cancer drug for children. The government were like, oh, that one, no, a bit expensive, let's get this one. Turned out the other one didn't work. These 2 doctors found out, essentially took the government to court, managed to get it banned in that country, and they went back to buying the one that actually works. But the problem is that those bad drugs were in 90 other countries, and no one really knew. There'd been a couple of scientific papers, but they hadn't published the names of the brands, because I imagine those journals did not want to be sued by a bunch of pharmaceutical companies. So we took this information, dug around a bit, uncovered that it had been in these 90 countries and there were a bunch of children at risk, and basically published the story, and we published the list of the substandard brands. And we thought really long and hard about it, because if your kid's it's basically the most common form of childhood cancer. If you've got a kid who's lucky enough to have got to a hospital and got this treatment, which is not a guaranteed thing anywhere in the world, and then you find out that the drug they're being given doesn't actually work, if you can't do anything with that information, then that's possibly worse knowing than when you didn't know. But after a lot of discussion, we decided to release the names so doctors could at least then look on their shelves. And our journalist did, to me, as points some kind of outreach. So we co-wrote an article that went into a big cancer research journal. We went to the meeting of childhood cancer specialists. Whatever you're investigating, there is a specialist group for it somewhere. We found them, we went and did a talk to them. One of the guys there said he still gets emails today from somebody in Haiti or whatever saying, I've got this brand. They're like, do not use that brand. So great, we've done all this stuff, we've found this data, we've brought together published data, we've generated some of our own information, we've tracked it through a shipping database, we've got pictures of the boxes. So we go to WHO, World Health Organization, we're like, hi guys, you've got a substandard medicines team, maybe they could take a look at this. A year later, crickets, nothing's happened. So a year after we published a story, we basically published another story that was like, WTF, WHO, oh my God, we should have called it that, right? And then they basically replied and said, oh, did you send some stuff? Could you just resend it? So we've resent it. Nothing's happened, obviously, but keeping on an issue is a thing. So the bad guy, the bad guy is probably, well, is this the bad guy? Someone in India is making kind of crappy active product. Somebody else somewhere is packaging it up. Somebody else is selling it on saying it's working. There's a million people in that supply chain, and they're all doing a little bit of bad, right? I think the point is, at some point, you've got a government and you've got a international body like WHO who should be overseeing it. That's kind of their gig. And if they don't know, because there's so many drugs in the one, it's very complicated, okay, maybe. If they know something's up and they don't do anything, and after a year we're still having to be like, hi, do you remember that email we sent? That is not okay. So I think you basically just have to be a pain in the arse, and then be a pain in the arse again, and continue to be a pain in the arse until either they've done something or, you've left your job and gone to another one. No, never give up. So yeah, I think it's not a sexy, quick hit journalism story, but it's super important. And again, what's the point unless you're using this information?
I'll just jump in on that to make the point. I think for those of us who watch The Simpsons, it's very rare in my experience in any kind of investigation that there is this Mr. Burns-like character, It's very rare that there's one evil mastermind responsible for everything. It's often, as Chrissie was saying, a series of actors who sometimes deliberately, but often through negligence or a lack of information, have just let things slide, right? I did a story earlier this year with the New York Times and a newspaper in Ecuador, because hundreds of kids in the United States were getting sick with lead poisoning because there had been cinnamon applesauce that had been someone had deliberately added lead to the cinnamon to make it heavier so they could make more profit from it, and that leaded applesauce was making kids sick. Now you would think along the way, from the cinnamon that grew in Sri Lanka, through the apples in Ecuador, to the shelves in the United States, you would think that someone would have tested the product for things that could kill kids. You would think. They didn't. No one in any of those countries. But I spoke to the guy in Ecuador who is now being charged with or accused of adding lead to this cinnamon. And he, first of all, he says he didn't do anything. We'll see. But his response really was very much, I'm just a businessman doing my job. The government has, by the way, no evidence that I've concretely done this. And in any case, I was relying on the people who sent me the cinnamon to have tested it for lead, and I was also assuming that the people who I sent my product to would have also tested it for some kind of dangerous product. So to me, it was quite a jaw-dropping moment, because I realized this guy didn't come across to me as the world's most evil mastermind. It was just a systematic failure of governments and the private sector to do what I think most of us would agree is kind of the most basic tool in food. Like, we assume that we go to Pam, the supermarket here, and what we buy is going to be healthy. It's not necessarily the case.
Susan, I just want to add that, maybe not someone who watches those regulations, but like the cost of doing these stories, the legal costs, are often, in our case, inhibiting factor, because when you deal with multinationals, they've got large established legal teams, and if you come up against them, you with your one lawyer need to pay for many hours. So we exposed a social media campaign where tobacco companies paid radio presenters, one was a journalism professor actually, people on social media to try and bring down the illegal selling of cigarettes in South Africa. And they tried to frame this because tobacco companies want less strict tobacco, and their argument was the stricter you make tobacco legislation, the bigger and larger the illegal industry will become. So they convinced these people to be part of a campaign thinking they're good people. You know, they want fewer illegal cigarettes, they want it to be more regulated, but it was the opposite. And when we exposed it, the tobacco company which was involved came down on us. We had to pay a lot of legal fees. And recently, we went to a rural part of the country where we exposed tobacco companies taking black farmers, tobacco farmers who are quite poor, and giving them support to farm tobacco in exchange for spreading that narrative. So you don't get to have the money unless you also say you're trying to fight and counter the illegal sales of cigarettes. And as soon as they had enough messages that went out from these farmers, they stopped supporting them. They could no longer continue to farm. And it was a story that could go into great depth, but we could only cover it up to a certain level because the implications, the legal implications of taking it further was just unaffordable to us. And I think, I know there are legal organizations that support journalists, but we couldn't get the legal support, that massive amount of support that we needed to take the story further.
That's a reality that I think many journalists face in many places, and sometimes it's insurmountable. Sometimes I think collaborations cross-border can help with that. I mean, you know, laws are laws in countries, but sometimes, you know, working with partners can help where they can take on some of the burden of the frightening parts of a story. Why don't we go ahead and open it up to a conversation with the audience now? Do we have a microphone for people to ask questions? So raise your hand if you want to ask a question. Maybe you want to know more about the reporting tools and techniques the journalists have used. How about here in the front?
Hi, thank you for the interesting inputs. I work for a small fact check. We do fact checks on TikTok. So I would be interested in the social media aspect. And if you think there should be more regulation, especially on health topics, and how do you see the boundary between health advice and lifestyle tips, maybe?
Anyone else have things to say on that?
Interesting. I can't be. Who wants to take it? Which of you would like to?
Well, I can say something quickly. Yeah, one thing we looked at during COVID was all of the grifting online, so the people selling salt water or silver or all of that bobbins. I mean, I think the difference between good health journalism, so not just health journalism, and like lifestyle advice is evidence. And I think we're all really guilty of wanting to find information that confirms what we believe, right? And so I think the fact you work at a fact-checking org, like everything we do is fact-checked, and we've kind of, we're only really coming around now to talking a lot publicly about the fact we fact-check everything. We have a full-time fact-checker, which I think might be the only newsroom in the UK that has that. I'm happy to be corrected if that fact is incorrect. But yeah, basically, I think online, you're never going to stop people saying stuff that isn't true. I think, and it's just not going to happen. I think our big tech team are looking at a lot of mis and disinfo at the moment around the UK election. But it's the same as in COVID. Like, no matter what we do, the system exists to allow those things that people want to be true to spread. And you can say a million times that you're like, here's our explainer debunking that. People will believe what they want. So I think the real levers you've got as journalists is kind of putting pressure on those platforms to basically to de-incentivize people. So if you say bollocks claims, excuse my French, if you say rubbish claims and, you know, they get picked up by the algorithm, then the companies need to stop. They need to be held to account for promoting things that aren't true. There's no point saying that's not true, close that account. It's like whack-a-mole, it doesn't happen. So I think, again, you need to take a systematic approach to these problems and apply pressure, to Will's point, at the right place. And sure, the influencers that are spreading misinfo are accountable, but again, sometimes they don't know.
Right, and it's often, you know, we did this dietitian story, right? But dietitians on average earn $65,000 a year, right? The world needs more of them, not less, I think. And so I think that the investigation really for us was not that people are saying you should give your kids a tub of ice cream before dessert, which some of them, before dinner, which some of them did. It was much more about if you're saying that, and if you're being paid to say that, then you should declare it. Not only should you declare it, but it should be understandable. So we spent a lot of time looking through TikTok comments where people were like, okay, you have a hashtag that says sponsored. What the F does that mean, right? Does that mean you're sponsored by the World Health Organization? Does that mean you're sponsored by Philip Morris or like General Mills? So I think for us, the investigation was, and the regulatory answer to this investigation was, much more transparency about who's saying what rather than what people are saying. Because people can say kind of whatever BS they want.
Should we take another question?
Thank you so much for the nice talk. My question is actually, it's really interesting to hear that many big companies funding research studies. And my question is, how do you find really credible sources to debunk the claims? And another related question is, this scientific research uses different communication, like their languages contains many domain-specific words, phrases, and how do you make it simplified for maybe readers?
I can maybe, for credible research, as a journalist, if you have a network of people who can advise you, it's really helpful. The first thing we always do is we compare it to other studies and see, is this a general finding or just findings from a minority of studies? And then if that's the case, we do start to look at the authors and see what their connections are, start with Google, and then start to ask other researchers, do you know this researcher and who do they work with? There are very well-established organizations like the Foundation for a Smoke-Free World, completely tobacco-sponsored, who produces research, so sometimes it's pretty obvious. What was the other question? It was how to get credible research and...
How to communicate it to
How to communicate it? When we edit stories, we spend an equal amount of time on checking whether the sources are accurate and de-jargoning it. It takes almost longer the part to make it simpler than as it takes as long as to take that it's accurate. What we've done at Bhekisisa is we have a news editor and a content editor. The content editor is not a journalist. She's someone with a PhD in science and who is very good with making science easy. And she would sit there and easily spend 10 hours on a story, a 1,200-word story, taking the research, translating it into something that's really easy to understand. And it's an important thing because the easier it is, the more people are going to read it. Even scientists who can understand the jargon, they've got competition online as to what they're going to read it. So the easier you make something, the more compelling it is and the more likely, the higher your chances are for someone to engage with that story and to act on it.
Yeah, I would just say as well, you don't need to have a scientific degree to be scientifically literate. So there's a big database called PubMed, that's where all published science papers go, and they can be papers in absolutely rubbish journals, they can be papers entirely created by industry-sponsored scientists. It's the place to go. So there's questions you will say, who funded this? How big was the study? So how many people? Was it in people or animals? What kind of study? Is it like a meta-analysis, so a study of studies, or is it a single case study of one patient? How old is the study? What journal is it published in? So again, just like there's quality of websites or quality of newspapers, there's quality of journals. Sometimes you get journals that exist purely to rinse people to pay. Oh yeah, if you're a scientist, you have to pay to publish in a journal. That's the other thing. There's an American non-profit called the Open Notebook, which is basically science journalists writing for other science journalists, and it's an amazing resource. Again, you don't need to be scientific to read it. They have how to do interviews, how to write features, all sorts of stuff. They're great. It's called the Open Notebook. They have a great guide to reading a scientific paper, but also if you just Google how to read a scientific paper, they're like, this is the abstract, this is what this means. You can do it. The fact you just have to look around, like Mia says, on PubMed you see a paper, it tells you the other places that have referenced that paper, it tells you other people that have done similar research. in the acknowledgements it should say who's paid for it as well. You can also go to researchers themselves and ask them questions. There's always an email address of somebody who's worked on that paper, and you can totally go to them and ask them questions. So basically, don't be afraid to engage. It's another source of information like any other source, like a company's database, like some leaked paperwork. It's there. So if it is scary, find your local science grad or friendly researcher like Mia said and ask them for help. But it's totally doable. The worst thing is not trying, honestly.
I think the tip I give to journalists a lot is, with science and health reporting, is treat it like any other topic. You know, as I said, I've reported on tax evasion and corruption and fraud for many, many years. And I'm not an expert in that. I didn't train in that, just like I didn't train in science. And you know, you ask experts, right? So you ask a friendly expert, can you help explain what this means to me? And remember not to always take the first answer, right? Because in tax avoidance, for example, what is legal, normal tax avoidance for one lawyer could be outrageous, unethical, behavior by another lawyer. And I've had that experience with science too, where I ask one scientist, oh, can you help me interpret this result for lead poisoning? And someone will say, seems kind of normal to me. And then another one will be like, holy crap, that's huge. So I think my experience in journalism is always to try a few experts and know who they are and why they might respond in a certain way. Like Mia said, like Chrissie said, find out kind of their experience, who they work for, because you're not always going to get the most unbiased answer with the first person you contact.
Okay, we're going to close now. I'd like to, in closing, say your program has the names of these journalists and organizations, all of our organizations. I'd suggest you look up the websites, and you can look at the stories and see some of the advice you've heard and background, and you can see it reflected in the stories there. So let's give everybody a round of applause. Thank you. Thanks, everybody. Nice job.
Thanks, Susan.
You didn't